Hello.
I thought you were going live on YouTube, so
Yeah, we are live on YouTube, but this is not our regular meeting. Why is Nandini there? Nandini, what are you doing on YouTube? Come on Zoom. Okay. Hello, Dr. Alexander. Have you been watching the replays?
Yes, I have, and no, it was really wonderful. All of you guys have done a really wonderful job. Thank you.
Thank you so much. What matters to us is that you all enjoyed and it was useful. Alexander, have you been watching the replays? Something is wrong.
Yes.
Why am I?
Sorry.
That's you, is it? Okay. All right. All right. Yes.
Now you can relax a little bit.
Yes. After today, I can relax a little bit.
The pre-conference thing was really fantastic as well.
Yes. That was what gave me the idea of having a post-conference.
Yep.
Because we have to have a venue to announce all the prizes.
Yes.
And I just thought, okay, we have a pre-conference, we have a conference, we might as well finish the cycle and have a post-conference.
Good idea.
Yes. And sort of gives everybody a chance to meet one more round.
Yes.
Yes. So, but I'm really glad. Yes, I think the pre-conference also was quite well received. Hi, Dr. Maya.
Hello, ma'am.
And I hope no one is having a problem accessing the replays, or because for the pre-conference, I had to shift it on the website and give you on that page.
I haven't tried yet. I haven't had the time.
Oh, please make the time. It's going to be only available till the 20th of May.
Yeah, so another 10 days. I know, but life is on a treadmill, you know.
Yes, I know.
It's
life is quite. Hi, Selvi. Hi, Bhuvan.
It's no, I actually still need the time to play lots of the other stuff as well. You know, just to listen to it again. It was, you know what? It was so much information.
Yes.
Usually I come away from a conference and I said, oh, well, this was great. That was great. You know, I remember this, remember that. This meeting was like, Kudoof, so much of material was shared and it interested me. I hope that other people got the same experience.
Hope so. Well, we did spend days and meetings just discussing the content. So,
yeah.
Yes.
So I just think maybe sometimes we just packed in a bit too much.
Maybe. But since we give everyone the chance to watch it for 15 days afterwards, I always feel it's okay if the content is a little extra. They get the chance to watch it.
Yeah, maybe. But I was actually, to be honest with you, I was battling just to keep up with it.
Okay, it is time. Let's begin. And right. Hello, everyone. And I hope everything is working fine. Yeah, right. So good evening and welcome. We are having a different sort of a program. We are celebrating the conference, which is the post-conference. But before we get started, there's something I need to talk about. And I know a lot of you realize that Oral Pathology 360's home is India. And there's a lot that's happening right now in India. And you might be wondering how we are going on. And well, there are definitely ongoing tensions in parts of northern India, and the situation is serious. The government has urged the rest of the country to continue life as usual. Not because it's a dismissal to say nothing is happening, but it's a statement, a reminder that we are very strong, steady, and really not easily shaken. So at Oral Pathology 360, because we are an apolitical platform naturally, but it would feel wrong to begin without recognizing that everything we are able to do here today is thanks to the infrastructure, security, and freedom provided by the Indian nation. And for that, we are deeply thankful. And our thoughts are with those affected and with the armed forces working to protect us all. With that in our hearts, let's turn to what we are here for, to celebrate the many voices, efforts, and contributions that made IODCPC 25 so special. I am so glad you are here. So let's begin. Let's move on now to one of the most joyful parts of any academic gathering, celebrating excellence. We are about to begin the individual presentation awards segment where we recognize some of the most thoughtful, creative, and impactful presentations across IODCPC 25. Before we start calling out the names, I want to quickly share something important about how the awards were decided. So, when we first planned the awards, you might remember that we had about 11 prizes in mind as it was advertised. But as the conference unfolded, we realized that a one size fits all approach wasn't the most equitable, especially given the diversity of presentation and judging panels. So, after a lot of discussion, we decided to revise the structure a bit. We now have 25 awards being announced today. And the reason is for poster presentations, we decided to award first, second, and third prize in each hall because, of course, the judges were different. And also, there were many excellent entries, each hall having over 15 posters. So we felt they need at least 3 prizes. For oral presentations, we kept it simple and we have given a single best presentation award for each session because there were just 6 or 7 presentations in each. In categories like the case series, where the number of submission was lower, we have thoughtfully combined categories and selected a single standout presentation. In short, while the number of awards may have grown, the rigor and fairness behind each decision has not changed. Every single award being announced today reflects genuine quality and careful consideration by our judges and our scientific panel. To everyone who presented the paper or poster, your work, your time, and your courage to share it with peers around the world truly made this conference what it was. And to those receiving an award today, congratulations in advance. You have earned this moment. So let's begin with pride and with applause for those who presented. And here is how we'll do it. I'll announce each award category and the winner's name. If you're here on Zoom, please turn on your camera, and when your name is called, we'd love to see you. If you're joining us on YouTube, feel free to say hi, a wave so that we know you're there. Once we have greeted you, we will present your certificate on the screen. So let me just share now. So let's start with the poster presentations in the postgraduate category, beginning with Hall 1. We had a wonderful set of entries in this hall, and I'm delighted to announce our top 3 winners. The first prize went to Dr. Susanna Augustine, the diagnostic acumen of idiopathic condylar resorption, a case report from the Department of Oral Medicine and Radiology, Pathology Dental College and Hospital, India. Now, I can't see if Dr. Susanna is here or not. The second prize goes to Dr. Pooja P.A., a specter causing relentless havoc, a case report on tuberculous osteomyelitis of jaw from Chettinad Dental College and Research Institute. I hope you are with us. If you are, please put on your camera. Dr. Prasad, please tell me if any of the people are there and put on their camera because I can't see.
Yes, ma'am. I'm checking.
Okay, thank you. Right. So I guess not. Let's move on to the next. And the third prize goes to Dr. Nabila Abdul. I think I saw her here. Think Beyond the Obvious, Department of Oral and Maxillofacial Pathology, Sri Balaji Dental College and Hospital. Dr. Nabila, are you with us? I think she was with us.
Yes, 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 I'm
Oh,
there.
wonderful. Wonderful, wonderful. Let me try and see if I can do something with this. Oh, okay. Yes, I got it back. Okay, thank you.
Hi, ma'am. Hi, thank you.
Hi, congratulations.
Thank you, thank you. Thanks a lot, ma'am.
Welcome. Dr. Prasad, can you do the honors of taking pictures?
Yes, ma'am.
Thank you. Okay, thank you so much. And yes, let's go to the. Did I display her certificate?
No, ma'am, I'm
No.
not
Okay,
able to
right.
see
Here
my
it is.
certificate.
I'm sorry. Yes, here is your certificate. Thank you so much and
Thank you.
congratulations.
Thank you. Thanks a lot.
Welcome. Now going to poster presentations, postgraduates category hall 2. So this is of course again postgraduates. Here also we have 3 winners. The first prize goes to Dr. Priti N. Oral B-cell lymphoma, a rare case report. Department of Oral and Maxillofacial Pathology, Chettinad Dental College and Research Institute. Second prize goes to Dr. Shubham D. Syndromic odontogenic keratosis, a case report, Department of Oral and Maxillofacial Pathology, Goa Dental College. Congratulations, Dr. Shubham. I hope you're with us. And continuing on, the third prize goes to Dr. Jyotika Preeti, diving deeper into ossifying fibroma, King George's Medical University, Lucknow. Well done, Dr. Jyotika. I sadly do not know what your department is, so we have not announced it. So moving on to poster presentations in Hall 3, where our undergraduate students were taking part, and they showcased some truly thoughtful case reports. It was amazing listening to them, and here is the first prize. Mehek Pant, scarce senescent gingival lymphangioma, a case report, Department of Oral and Maxillofacial Pathology, Manav Rachna Dental College. Oh, yeah, here. Okay, wonderful. Wonderful. Congratulations. Yes, you all did a great job. And the second prize is Ankita B. Hidden Peril, Undiagnosed Cemento-Osseous Dysplasia, Chronic Osteomyelitis. Again from Manav Rachna Dental College. Congratulations. And I don't know if Ankita is here. Yes, not. Then the third prize, which is shared, is Sejal Nilesh Katod, Degenerative Disorders of TMJ, Department of Oral Medicine and Radiology, MIDSR Dental College, Latur. And, sorry. Yes, congratulations, Sejal. And the next one is Yukta Yadav, eruption cyst in maxillary anterior region of pediatric patients, a case report. Again from Manav Rachna Dental College. Congratulations, Yukta. And that brings us to our next category, faculty posters, which had some deeply insightful cases. And among those, now it is where it was Hall 4. Our first prize is Dr. Nairika R, Bridging Dental and Renal Health, Enamel Renal Syndrome, Department of Oral and Maxillofacial Pathology, Goa Dental College and Hospital. And the second prize is Dr. Reshma Venugopal, a case of blown out mandible cortex, Department of Oral and Maxillofacial Pathology, Krishna Devaraya College of Dental Sciences and Hospital, Bengaluru, which is also in India. And the third prize, which is again shared, is Dr. Anila Kuneru, hemangioma of masseter muscle with calcifications showing Turkey Wattle sign, Department of Oral and Maxillofacial Pathology, Navodaya Dental College, Raichur, and Dr. Poonam S. Adenoid ameloblastoma, a case report with literature review. Department of Oral and Maxillofacial Pathology, Goa Dental College and Hospital. So congratulations to all our faculty presenters. Thank you for your presentations. Now coming to some case series, the best poster presentation, this is a shared prize again, the best poster presentation in the case series category, where both recipients demonstrated depth, clarity, and relevance in their clinical storytelling. The best presentation is shared by Dr. Spriya Jha, Hidden in Plain Sight, a case series of oral tuberculosis from Maulana Azad Institute of Dental Sciences. And Dr. Vaishnavi M. for uncommon yet significant case series on autokeratinized odontogenic cyst. PG student, Department of Oral and Maxillofacial Pathology, Government Dental College and Hospital, Chhatrapati Sambhajinagar. And we go on to oral presentation awards. Here, as I mentioned, there are mostly one. So the best presentation award for session 1 in case reports went to Dr. Rishabh Sachdeva. It's a rare hidden neurofibroma of parotid gland, challenges and clues to diagnosis, from Maulana Azad Institute of Dental Sciences, Delhi. And the next prize, which was for session 4 case reports, went to Dr. Chamundeshwari P. for multifocal oral malignancies in a smokeless tobacco user, unveiling the impact of field cancerization. Department of Oral Medicine and Radiology, Chetinath Dental College and Research Institute. I think our next award is shared again. It is the Best Presentation Award for Session 5 in Case Reports. It's shared by Dr. Akansha Bharadwaj. An unusual case of focal cementoosseous dysplasia of the mandible, Department of Oral and Maxillofacial Pathology, Government Dental College, Sambhajinagar, Maharashtra, and Dr. Fatime Shirwani Farsani, evaluation and comparison of the effects of different wavelengths of diode laser in the removal of epulis fissuratum. Oral and maxillofacial surgery resident, Isfahan, Islamic Azad University, Iran. And the best oral presentation award for a case series, this is for the whole conference across all sessions, is Dr. Gangisati Shanmukha Sivaswarup for Taxi Uncovered, a comprehensive case series. Department of Oral and Maxillofacial Pathology, Vishnu Dental College. Yes, you're here with us.
Yes.
Hello.
Thank you, ma'am. Hello, ma'am.
Welcome. Hello. Let me bring your certificate. I seem to have not brought it. Yes. Congratulations.
Thank you.
Welcome. And to continue, yes, our faculty presenters. Best Oral Case Report Presentation Award. And by the way, everyone who's here, please don't go away. So at the end, we can all meet. Right. So the best, what am I saying? Best Oral Case Report Presentation Award is Dr. Debarti Ray for session 2, solitary fibrous tumor of gingiva, rare entity with immunohistochemical profiling, Dr. R. Ahmed Dental College and Hospital. And for session 3, it is Dr. Revati Krishna, Pernaculate Carcinoma, Old to Eyes, New to the Dictionary, Maulana Azad Institute of Dental Sciences. The best faculty award case series for the whole conference was Dr. Rupavati K. Adenoid ameloblastoma, report of 3 cases with clinico-pathological challenges, recurrences, and treatment outcomes. From Department of Oral and Maxillofacial Pathology, Vaidehi Institute of Dental Sciences and Research Center, Bengaluru. Congratulations, Dr. Rupavati. It's lovely you're here with us. And we will meet at the end of the presentations. Please don't go away. So the next presentation award in this category is Dr. Supriya Kevur. This is our last one. She presented a confocal microscopy bringing cells into focus. She was the only presenter for, or she rather got the prize for the new sessions that we had started, which was Diagnostic Innovations Showcase. She presented a very nice case, and she is from Department of Oral and Maxillofacial Pathology, Dr. D.Y. Patil Dental College and Hospital, Pimpri. So our sincere congratulations to all of you brilliant educators, specialists, students, to everybody. Thank you so much. With that, now I am going to stop the share of the certificates and move on to the institutional awards, for which I need to remove my virtual background. As you can see, why? I hope you can see the, oh, you can't. Can you see the prizes behind me?
Yes, ma'am.
You can. Okay, good. I was a little worried that they couldn't be seen. Okay, so yes, these are the prizes. I would have shown you, but it just goes terribly out of focus when I try to do that. So the institutional awards, the true circle of excellence. As we honor individual achievements, we also pause to recognize the institutions and departments that have truly embodied the spirit of IODCPC25, bringing us these wonderful people and these wonderful presentations. They have true commitment to patient care, academic excellence, and leadership. We are delighted to share that winners of these institutional awards will receive a custom designed trophy, a small but heartfelt token of appreciation from all of us at Oral Pathology 360 and the organizing team of IODCPC25. So the Excellence in Patient Care Award. It is awarded to Manav Rachna Dental College. This award is given to the institution with the highest number of accepted case presentations, demonstrating exceptional engagement in the real-world diagnostic and patient care practices. So, of course, all these trophies will be sent to the colleges and the one department definitely in a short while. The next award is Department of the Year, Excellence in Patient Care, awarded to Department of Oral and Maxillofacial Pathology, Vishnu Dental College, Bhimavaram. This department's case presentations stood out for their depth, relevance, clarity, earning them this distinction. And the last but not the least is the Excellence in Learning and Leadership Award, awarded again to Manav Rachna Dental College. Beyond clinical submissions, this institution fostered participation at every level: students, faculty, presenters, moderators, and brought an energy of true academic leadership to IODCPC25. So, congratulations, everybody. And I would love if anyone is present from these three institutions, or from the departments and Manav Rachna Dental College. I would really love for them to, put on their camera so we can see them and everyone can see who are these wonderful people. If anyone is with us. Okay. Oh, someone is there.
Yes. Dr. Anchal.
Okay, you are
Dr.
from
Manish.
Manav Rachna Dental College, I suppose.
Manav Rachna Dental College, yes, ma'am. Thank you so much for everything, ma'am. It was a great experience, ma'am.
Wonderful. Thank you so much for being a part of it and so actively being a part of it. It was true
Thank you, ma'am.
leadership and excellence from your college.
Thank you, ma'am. Thank you so much.
You're welcome. Absolute wonder and absolute joy to have you all. Thank you. And I do know that we have at least one PG from Vishnu Dental College. Dr. Ravikant himself could not attend because of some emergency, but well, it's okay. I just request everybody to stay on. So at the end, yes. Yes. Yes, they are. And Dr. Manish, hello. Congratulations on your college getting 2 prizes. And Dr. Vikas Kumar is from Vishnu Dental College. Yes, from the oral pathology department. Congratulations. Please
Thank you.
accept the award on behalf of your department. Well
Thank
done.
Thank you.
Welcome. Welcome. So, yes, now the next thing is about our abstract book that has been released. Looking ahead to the future is great, but we also need to pause and celebrate a milestone from the past. At IODCPC24, also we witnessed an incredible range of presentations, and as part of our continued effort to preserve and share academic contributions, we invited presenters to submit their work for publication in the official abstract book. The book we are releasing today includes abstracts from those who opted in for publication and provided their details in a timely manner. It reflects not just scientific insight, but also initiative, follow through, and a shared commitment to academic collaborations. To mark this moment, we made a short video. It is not of the whole book, it is just of the few pages, and obviously the pages were many more, but I will just share that video with you all. You know, today, while I'm making all the announcements alone, I'm realizing just how tiring it is. And I'm ever so grateful that in the conference, I did not have to do everything myself. The reason I'm doing this alone today is simply because I did not think of it early enough to ask the wonderful team to step in and help me. By the time I thought of it, it was too late to ask any of them. But really, this reminds me just how wonderful our team was and how much of the work they carried on. Yes, indeed. Yes. And, because really a conference of this scale, there's just no way one person can do it. It is a number of people and not even just your organizing team. Now, there was this little video I shared on social media. Maybe many of you have seen it, but I'm going to share it again because it has the names of all the hosts, co-hosts, moderators, and judges. And just as a side note, it's in alphabetical order. So I just thought it is the best way to do it. I am going to just share that. Thank you again, truly, for all the wonderful work that everyone did that made such a seamless conference happen, from the pre-conference to the conference to having so many things happening all at the same time. Thank you is all I can say. Yes. So, right now, of course, before we wrap up, let's just talk about the fact that we are already on with the preparations for IODCPC26, which will be held from May 8th to 10th of 2026. And we hope that you are going to start looking for your cases and thinking of your presentations and all the wonderful things we are going to do. And you are going to be all waiting to join us. But before we do that, let's take a look at what all we achieved this year, what all we did. What are your comments? What are your thoughts? Anyone who is here, please put on your camera, please put on your mic and tell us. Nothing like telling us. How can we improve ourselves? What did you think could be better? What could be different? Wow, Prasad, that's the good news you shared in the chat. Okay, we have agreed for a ceasefire effective 1700 hours. That was an hour and a half back.
Yeah.
Okay,
Just
that's
when you started the session, I think we got that news.
Yes,
It was
that news
yes,
was going
because
on.
I had been binge watching. I mean, the whole day on my one screen for the last 3 days has been news. So the last thing I saw was that we were still going on. So this is another good thing to really celebrate. Wonderful, yes. And thank you for sharing that with us. On that high note, now let's ask everybody. And Nandini, I'm glad you came here. You found your way.
It was nice meeting here with all the academic partners. It was a wonderful conference and wonderful exchange of scientific knowledge. And hearty congratulations to all the prize winners and the participants. Participation is much more important. So I think everybody is a winner here.
Totally. Absolutely, yes. So let's hear from everybody. Our few prize winners who are here with us, please put on, your mics and your cameras and join us. I can see a lot of people on my other system and all the cameras are off. So I'm going to request everyone, please put on your cameras and join us. Yes. And tell us what we can do better. Next year, what would you want that maybe we didn't have this year? Any thoughts? You can also tell us if we did something nice. I mean, that also is good. What did you like? What did you enjoy? It's good to hear. Dr.
I think
Nagavan also is there. Oh, but it's very early morning there.
I think all the year, all of you guys have done a wonderful job, and having organized conferences myself, I'm at a loss for anything that you can do extra that you haven't already done and thought of. It's just so broad with pathology, oral, and everything else. I'm not sure what else can be done better. Just continue doing what you're doing, I think.
Okay, thank you so much. Thank you. That's nice to hear. That's really nice to hear. And anyone from our own team wants to say what maybe could have been better? Yes, Bhuvan.
Yeah, good evening and greetings, everyone. It was indeed a wonderful experience. As last time, my comment was that it was a knowledge extravaganza, and this year, what I have found that this is a mandatory conference for all the oral diagnosticians, but because the diagnostic software needs to be updated in us, so it's actually installation of the new update of the software every year. So this is my thing, and I think we can add the pathogenesis part as a part of the disease. Though it is the name is case presentation, everybody can learn the diagnostic algorithm, which is the basis of arriving at a correct diagnosis. So no such improvements are required as a whole, but we can consider this thing as we have included diagnostic innovations. So that is my thing, and I request all the participants to enroll for the next one. 2026, which will shortly we will come up with the first call. And that's it, ma'am. Thank you so much for providing me the opportunity to work as an organizing team member for the second time. And I'll try my best to take forward the IODCPC legacy. Thank you so much.
Thank you. Thank you. There's one, I can see that Dr. Priyanka Banushali is there on YouTube. I don't know why she's not here with us on Zoom, but you might have noticed she is one of the editors of last year's book. She, Dr. Anupama Mukherjee, and Dr. Raisa actually helped me because last year's book was, I have to say, in a real mess. The abstracts were all over the place. They were not following any format, and even getting everybody's email IDs and getting everybody's names and all the co-authors affiliations took quite a lot of work. So they really stepped in and they helped, and they are the co-editors of the book. So sadly she seems to have missed somehow and landed up on YouTube. Anyway, thank you, Priyanka. Yeah, she did help also with the conference in a lot of ways. And there's always a lot of work that goes on that maybe not many people know, but I have to say that the organizing team met for over 12 weeks every week, and we had a group going that also discussed otherwise. So I was just making fun and saying, because somehow we were so busy, I could not post any of the photographs of our meetings during when they were happening. So I was just telling everyone, the same way we have the 12 days of Christmas that we celebrate, afterwards I'm going to celebrate the 12 weeks of our organizing committee and share the photos. So that is something that will come up from our end in a few days, and you can see behind the scenes how everyone was getting ready and how the discussions were going on. And thank you, Dr. Elizabeth. Thank you for that comment. Anyone else would like to say anything? We have also got some comments on YouTube. And Dr. Vinay Hazara says there, hello, sir. I hope you're doing well. Dr. Divya is there. Hi. And Dr. Arshia Ara. Thank you. Okay. So Dr. Abe has joined. Hello.
Yeah. Good evening.
Good evening. Yes.
I must congratulate all of you for nice efforts, and it was a nice exchange of this thing. What I wanted to tell, if you can include the students also, I am working in a dental college, and if we can include the students also in this matter and keep separate sections, some of the separate sections for students, that will be little helpful. That's what I feel.
Yeah, it is very, very, very thoughtful. What you mean by separate sections? Because we already had sections for presentations by undergraduates. Do you mean
No.
lectures that are for the undergraduates?
Yeah. There should be some exam oriented stuff that should be included. So that will be helpful for the students also. And the activities, it should be given to all these things, then informed to all the dental colleges because I think all the colleges were not informed. So there is a less participation. Your participation will also include, this thing, number of participants will also improve in this matter. So that's what I wanted to tell.
No, very, very, very good points. Actually, we have been trying definitely to reach the colleges.
Yeah.
I did try through email to reach everyone, but repeatedly, but I think some of the emails are not really updated.
The thing is that if you can contact one faculty from each college and you can include those people in your organizing team, so that they will have a positive approach towards including more people. It's like that.
Yes, that's an interesting idea. Yes, definitely we will consider it, and it's a good idea. Yes, thank you. And very good points. Very good points you raised. Yes.
Hi, ma'am.
Yes, Dr. Gauri. Hello.
Yes, ma'am. It was so excellent and extraordinary coordination, ma'am. It was precise, like entire side by side, all the sessions were going seamlessly. That's what I felt. And being an online conference, I think you will have a lot of technical issues. But on our side, we were not able to see that. It was quite very seamlessly, it was going on. And I would like to congratulate all the participants, ma'am. And here, I just want to tell one thing. Most of the academic forum, they focus on research oriented papers. Give more credit to the research papers. But what I find here in your platform is real case based studies, which is actually very encouraging for all the oral pathologists, I feel, especially those who are not related, who are not attached to any institution. So I think they are also being given equal chance. So that point I really liked it, ma'am. Thank you so much, ma'am. Thank
Thank
you.
you for joining us. Thank you.
Yes, ma'am.
Yes, and that seamless organization is thanks to the team.
Yeah, ma'am.
Okay, great efforts. Yes. Thank you. Very nice. True. So, yes, Dr. Ashia is congratulating all of us. Thank you so much. And anyone else would like to say anything?
Ma'am, I would like to add up.
Yes, please.
Even though Dr. Gauri said we are all, involved in this, but the mastermind and the concept and everything has come from you. So we have to thank you so much for such
Yes,
a platform where,
rightly.
I mean, we
Yeah.
are just,
Yeah, big thanks to you, ma'am.
but
Big
the
round of applause
Thank
for
you
you.
all. Thank
everything
you.
is the vision was yours, so I congratulate you on that. And of course, yeah, I think we have reached a wider audience this year,
Yes, we have.
including all the general dentistry and all the triple O departments from all over the globe. So that itself speaks for its magnitude, the
Yes.
impact of this conference has actually.
Yes. I was also very happy we had people from oral surgery, oral medicine. We need to increase those numbers. In fact, we had people who were watching the general dentistry topics too, which was really amazing. Yes.
Not just that, ma'am, even Ayurvedic and
Yes.
homeopathic, that was
Yes.
also included, no? So that it was
Yes.
all health sciences in general, actually.
Yes. True.
Yeah. We may include next year even nursing people also, their perspective regarding dentistry,
Yes.
paramedical field, no? The
Mm.
remaining physiotherapy, those fields also, I think we can extend further into those
Yes.
fields also, like, because creating awareness about dentistry, no, that will give them even wider, we will have more referral patients, I guess.
Yes. And patients will be benefited definitely a lot.
Yes.
Yes. Yes, Professor Hiller, what do you want to say? We are waiting to hear.
Hi. I've got just two ideas that are coming to my mind listening to the conversation. The number one is it might be an idea to introduce a live CPC session. In other words, we have, let's say, 5 or 6 or even 10, that's quite a lot, persons that will put up a case, a clinical picture or a radiology or a combination, and then invite somebody actively to speak to the case and show how they would come to a differential diagnosis, what they actually think is a diagnosis, but in a live version. So in other words, you have a Q&A, basically based on the presentation of the case by one person, and then the person that has presented the image first can then come back and say, well, this is what we actually thought was a diagnosis. Sort of like a live, and then you could sort of explore how would you think about resolving a case, as was alluded beforehand, actually the diagnostic algorithm. It might be an idea to maybe start with 5 cases next year in a live session. That would be one suggestion. I don't know what you think about it. The second one is maybe introducing I've actually recently been participating at examination seminars from our college who actually add like an MCQ or 2 or 3 about a certain subject that you have to respond to in order to qualify for maybe a CPD extra or anything that is rewarding, so that you can actively think about what you've learned and apply it and get some questions about it and answer that online. It nowadays not that difficult to devise that. So just 2 of my suggestions.
Very nice. Yes, we can do even a self-assessment, a pre and a post sort of a test. Before answer it and afterwards answer it and see whether you got your answers right. Or what was,
Yeah.
how much have you
Yes.
learned by watching whatever you were
Yes,
watching.
yeah, because somebody was saying, well, in preparation for exams, so we might just add that into, and you will probably find that a lot of people will be very interested if there's that active like of participation of testing your knowledge.
True.
So we
Very
could
true.
just think about the modality.
You have to work on it. Yeah, it's a good idea. And your first idea also, I guess it's a little like how we at the moment have in oral pathology, we have slide discussions.
Yes.
So, but extending it beyond the slides to include clinical and maybe, clinical diagnosis or clinical cases, or even management for that matter. Yeah.
Yeah.
It is
Yeah.
something we can
Yeah.
definitely work on. It will be interesting.
Maybe you can start that on the 360 sessions and see how it goes. And then you can incorporate in the meeting next time.
Yes, that's a good idea too, Dr. Narayana. Yes, very,
Mhm.
very good idea.
Interdisciplinary section should be there. Like if any case is having a multiple parameters, like you can include, there is a triple O that has been known: oral pathology, oral medicine, and oral surgery. Along with that, if there is a case of radiculocyst, you can include the endodontist also. And that way the case presentation and some discussion has to be done. Questions should be taken from the participants and that should be answered. And some positive approach should come for better treatment planning.
Yes. Yes, true. Very good. We have a suggestion from Dr. Reena Mehta. She appreciate wonderful session of live slide discussion and wish to include forensic aspects of dental evidence. Okay, so next we will have to add forensic. Yeah, we can always add one lecture of forensic. Why not? It's very much a part of the whole scene. Definitely interesting. Yes. So, and all good things come to an end. And so should IODCPC25. And yeah, we have to move on. It has been really wonderful. And I have to say, I guess if no one else wants to say anything, yes. Dr. Prasad, you took enough photos, I assume.
I have taken.
Okay, thank you.
I'm only remaining. I will also love to say
Yes.
thank you to all of you, especially to dear Dr. Vandana. It was really wonderful working with you. And all the sessions, everything brought about unity. And I was able to see so many people, and all the sessions went without any hitch, no interruptions at all. And I always think and say that you are one woman army with so many people supporting you anyway.
Yes.
And
that's what makes it possible.
Yeah, congratulations and best wishes to you and your team.
Yes, it is really, it's having a thought, however innovative and however original, is just a thought.
Yes.
It is important to put it into action, and to put something of this size into action really is not possible alone. Something of this size, it's not possible. You can have a one-day conference or a one-day, a few hour session alone. But beyond that, and multiple sessions and different things happening, you cannot do that alone. So at the end of the day, it has been truly, I'm not just saying it because it sounds nice or it's the right thing to say. No, I mean it. It has been truly a teamwork. And I think everyone has really done their bit. The best part of it, I guess the fun part of it is we get together and do so much of work, but we have fun doing it. And that's every meeting is fun. I mean, that is 6 months of the year that we all meet and we interact with friends from across the globe. It's a very different feeling, and it's a very different thing from our everyday work, and that makes it fun. And we also achieve something great at the end, and that's the best part.
Cooperation with you worked on the Women's Day, and it is continuing with IODCPC25. And I would like to be working with you as part of PFA, and maybe maybe in part of our institution also, maybe in the next year. We will see.
Wonderful.
Thank you very
Yes.
much.
Thank you. We hope that all our partners will continue with us with 2026, which we have already fixed the date. We will be setting up things much earlier this year. We are planning on a larger conference, on a bigger way, on a bigger scale, and definitely going to go bigger. Yes. Thank you. Okay. So, and Dr. Selvi also is saying thank you. And as an organizing committee member, really appreciate the opportunity. Oh, you're most welcome, Selvi. I love working with you. And I love working with every one of you and meeting everyone who attends the conference. So let's wrap up and let's say thank you. And each and every one of you, again, thank you for your time, your energy, and of course, your trust to be with us in this journey. It's been an amazing journey. We hope you will come back with us again next year. So now we are officially closing IODCPC25 and beginning IODCPC26. So until we meet again, stay curious, stay connected, and stay happy. See you all. Bye.
Bye-bye.
Bye.
Bye, everyone.
Hope to see you next year again.
Yes,
Same crowd.
absolutely.